unless you subsidize them. Finally, Louisiana penalizes Southeast Louisiana more than it does the rest of the state. If you are a wealthy Medicare beneficiary anywhere in the state, you get 100% of your benefit. If you are a poor Medicare beneficiary in 60 Louisiana parishes, you get 90% of your benefit. But if you live in Orleans Parish, Jefferson, St. Bernard, or Plaquemines, the most you can get is 85%. What happens, just as Social Security gives us a cost of living increase as prices rise, the law says that Medicare gives us a cost of practice adjustment as things cost more in each area. After Katrina, the cost to practice medicine in these 4 parishes costs more than anywhere else in the state. So Medicare gives these 4 parishes a 5% bonus. Louisiana doesn't care about that. It strips away 10% from all parishes and then strips away that other 5%, putting us at a competitive disadvantage from anywhere else. If I move from Orleans Parish to St. Tammany Parish, I will get a 5% bonus. If I stop seeing poor people or move to a different state, I will get a 15% bonus. I have a petition signed by 39 elderly and disabled people in my practice asking the council to please approve this resolution. Of these 39 elderly and disabled people, 38 are African American, 31 are women. 1 woman is 99 years old, and 1 woman is 102 years old. So on the behalf of these people and thousands of people elsewhere, I respectfully request you to approve this resolution. Be it resolved, the New Orleans City Council requests the state of Louisiana restore Medicare, Medicaid crossover payments so all Medicare beneficiaries in New Orleans have equal access to the Medicare benefits. Thank you.
Thank you, Dr. Hersh. That was wonderful.
Can I ask a question?
You. And we're going to open it for questions. Mr.
Is there an insurance system that could fill that gap, or would there be?
Probably not.
Okay.
The issue here is that everybody works for Medicare, pays the same taxes, and we expect to have the same benefit. Medicare is a nationwide system for everyone. The policy of having each individual state manipulate a federal benefit to balance their budget is unjust, and that's what this is about. Louisiana is trying to balance its budget on the backs of elderly, disabled, poor people, the most vulnerable people we have.
Create some equity in the system. I assume in '99 when Congress took this up, the unintended consequence of their action, it was to help the states from a financial standpoint, but the unintended consequence was to really hurt people in poverty.
Yes. It hurts our state. One of the reasons that we are so low on the healthcare rankings that came out, very low at the bottom, they specifically say that we have one of the highest rate of preventable hospitalizations in the country. Duly eligible people with Medicare and Medicaid have a preventable hospitalization rate that is 40% higher than people who do not have Medicare and Medicaid. It is these people who cycle through emergency rooms, hospitals, and nursing homes because they don't have access.
Has what Stacy was alluding to, I mean, we could pass a resolution, and hopefully this will help you as you go out to Baton Rouge, but has there been any legislative action at all over the last 8 years in Baton Rouge or in Washington in order to remedy this?
Different states have tried different things. In Connecticut, for example, Connecticut is a wealthy state where 82% of the people are white, but if you look at Hartford, Connecticut, 78% of the people in Hartford are African American and Hispanic. When Connecticut did the same that Louisiana did in 1999, according to the Medical Society in Hartford, Connecticut, 42% of the people stopped seeing these people. They stopped seeing them in nursing homes, stopped accepting them. And Connecticut, with legislators, patients, media, physicians, got together and changed the law. Yeah. And that's what I hope to do with this with my coalition.
I mean, I'm not a constitutional law expert by any means, but it seems like you're almost invoking you're potentially violating some kind of equal protection argument because of the disparity that's been caused by this.
The first step is here, ladies and gentlemen. After that, then, This will be taken up to Baton Rouge, and then finally it needs to be addressed in Washington. But your support is key to this issue.
But more importantly than us just sending, Dr. Hersh, and so that everyone will know, Ms. Hedden and Mr. Philco and everybody, more than just sending this piece of paper to the legislature, I think it's incumbent upon us as a council, and we all know different people up there, and especially those of us who served up there. I think it's incumbent upon us to follow this up and be like your army and go there and make this, make this a priority. I think, all right, any other questions, any other discussions? Ms. Willard Lewis.
Dr. Hersh, I want to thank you for your commitment.
Thank you, ma'am.
For your courage and for your examination of this issue in terms of all the levels of impact. As you know, I care there. Let me just share with you. I agree with many of the conclusions that you reached rather, relative to the equal protection, relative to violations of civil rights, violations of access for handicapped and disabled. And I, along with our president, want to believe that that was not the intent, as perhaps legislation was advanced out, but it needs to be corrected. They can't keep their staffs, they can't meet their payrolls, they can't stay with the latest equipment, they are giving and giving and giving. And so I want to commend you for not letting dollars dictate where your Hippocratic oath and your heart to make a difference has led, but it's put you in a bent of solving the problem, not only of healing the sick, but of solving the problem so that you have greater capacity to heal the sick. And I am committed with you to go wherever, to Baton Rouge, to speak and testify before a committee, because we've got roadblocks at the local level, bringing back online our hospitals and bringing back in our physicians, because they are in other states. And they do see the difference in the payments. And so in order to get them to come back to Louisiana, we've got to have more to offer. We've got to at least be equal and online with what the federal government allows. And shame on us if we don't get that right. Again, from this level of local government, testifying at the state level, and then moving on to the federal level, where it appears that health care will be one of the major reforms on the domestic policy agenda. This council has tackled many things united. We've gone to the federal government to ask for relief from the Stafford Act, from FEMA, to a regional transit authority, a relief for the buses that were all flooded. We have gone there as a team, and it has made a difference. And I'm sure that this is one issue that we would embrace, because in each and every one of our districts, there are underserved neighborhoods and desperately ill people whom quality, competent, and compassionate physicians like yours can make a difference if they had the additional resources to serve. So thank you for being here today, and we will walk with you moving forward.
Thank you, ma'am. I would just like to say that the decision that you make here today will affect the health care for 5 million elderly and disabled poor people across the United States.
Thank you, Dr. Hersh. And you'll be, all right, I move to, and adding all as co-authors, Madam Clerk, I move to pass motions and resolutions lying under R 08604.
Second.
Seconded by Mr. Philco. Vote your machines. 6-0, so ordered. Thank you.